Hello, I am going to do a video on postpartum instructions in the postpartum period. So initially what we do is after birth, after we've done immediate postpartum care, assess the well-being of the mother and baby, and once both of them are stable, everything's cleaned up, everything is basically done at birth, then we provide postpartum care instructions. They are on Mobile Midwife, that's where we have them, but generally we like to print them out so that way the mom actually has these postpartum care instructions on hand in paper, so it's easier for her to access. And this will be left right by her bedside just so she can easily access it. So a couple things that should be in the postpartum instructions include normal development of the baby and normal things such as the irregular breathing. Sometimes babies tend to and then breathe regular and do it again. It's very irregular, and that's normal. And it's also normal for sometimes babies don't poop for a couple days, so that's also there. And also just temperature, respirations, any abnormal sounds, just really what to expect from babies. Their urination, how their poop starts out as a tarry, mech, and then it will turn into more of a yellowish, seedy poop. So just that's the first part of the postpartum instructions. It's basically just the normal behavior for newborns, and then we also go into what is abnormal. So if you have a baby that has really high respirations, just really breathing hard, like they're trying and they just can't get that breath, or their breaths are short, then that is something kind of concerning, and it's something to definitely consult with a care provider. And also if baby's just not getting pink and there's a lot of blue, or especially the core. If the core of a baby is blue, that's definitely concerning. And also any trouble breastfeeding. So anything along those lines, anything that's abnormal, if we have any distress. And then we also go into, weight gain. So baby is actually expected to lose up to 10% of their weight, their birth weight, but that's normal. Anything over 10% is concerning. If baby catches a fever or if they're cold, should also signs to look out for infection in baby, abnormalities, anomalies, defects. And also on the postpartum instructions is the well-being of the mother. So what is normal, basically involution of the uterus, vitals that are normal, vital signs, adequate rest, drinking enough, staying hydrated, and also bleeding. So bleeding is normal. It could be all the way up to 6 weeks, generally ending around 2 to 4 weeks. So basically, what is normal? Blood clots can also be normal as well, as long as they're not bigger than my hand. And if there are a lot of blood clots that are big, then that's definitely something that's concerning. If mom develops a fever, if there's any signs of infection, any signs of retained placenta, or just leg cramps, abdominal cramps, pelvic cramps, mastitis, infection of the breast, anything that's abnormal will also be on that postpartum care instructions. Along with that, we're also going to have the information for the birth certificate. So how you go about filing for a birth certificate and social security card and all of that. So that is generally done, the paperwork, by the midwife, and then it's given to the client, and the client has to take it down to the department to get their birth certificate. And then just general considerations, how to take care of a newborn as well. So how often to change diapers, and what they need. They need rest. They need to feed frequently. The first day or two, they should be feeding every 2 to 3 hours, and after birth, how they're going to sleep. They could sleep up to 4 hours, and that is considered normal right after birth. But anything after that, you want to wake up the newborn and make sure they're feeding every 2 to 3 hours to make sure that they're getting all the nutrients that they need and they're not losing too much of their weight. So, so basics, just normal, what is normal in the newborn, what is normal in the mother, abnormalities, things to look out for, how to care for your newborn, and also postpartum depression. So we do go into signs to look out for: baby blues, postpartum depression, signs that you are kind of going that route, detachment from the baby, not really making contact, feeling sad, feeling severely depressed. So those are things that are also on the postpartum care instructions. And lastly, we have just general health and resources. So resources for you as a new mother, breastfeeding resources, groups, and just basically resources to reach out if you need support or help in any way. So thank you for listening. Bye.